Dr. DSchlundt from Vanderbilt University. Dr. Schlunt, before we end the show for today, let's see if we can have you to sort of work us out of the situation that we find ourselves in. You see, to give us some directions in terms of how we might be able to better meet this real health issue. Not only is it an issue of obesity, but it's an issue of health. Yes. You see, and let's see if we can work that out.
It's primarily an issue of health in my mind.
Very good.
Well, okay, there's two sides of it. One side is concerted action by communities to try to make the environment a healthier place for our families and our children. The second side is, to the extent that that's difficult or hard or is going to take 25 more years to do, we as individuals and families have to take steps to live healthier despite the difficult environment. So on that environment side, we've got efforts like those by the State Department of Health that are going to try to bring attention to the problem. A law was recently passed in the legislature to regulate the availability of junk food and sugared soft drinks in the elementary schools. And for example, if I wanted a prescription to make a child fat, I would give that child 2 20-ounce soft drinks every day and say, drink these up.
Is that bad?
And you're getting 500 extra calories a day right there. That's enough to gain a pound a week. So yeah, these are not trivial issues. The extra calories from the soft drinks, the potato chips, these are all these things add up. So we're going to be looking at ways to try to make the environment healthier. If, for example, we walk outside behind the studio here, what do we find? We find that beautiful new Metro Greenway along the river. So we need to make safe and pleasant places for families and their children to go together to walk or ride bikes. We need to make sure there's playgrounds accessible to every neighborhood and every child. We need to make sure that there's physical activity that's built into the child's school day. So there's a lot of things that we can do. We may need to even look at some questions about how can we regulate the food industry. For example, in Britain, they've passed a law that food companies are not allowed to target their advertising at children during cartoon time, for example. So we may have to look at layers of solutions that deal with public policy, deal with the environment. We also have to work with the communities. So, for example, the African American community is disproportionately affected by this problem, particularly women.
Explain that.
Well, if you look at the way the weights develop from childhood through the teenage years, boys and girls tend to be about the same until about puberty, and then the girls keep getting heavier and heavier. What happens is that the African American girls, that curve is going up even faster. That's resulting in much higher rates of heart disease, hypertension, and diabetes. By the time African American women are 55 or 60 years old, 3 out of every 4 are overweight. So we have to think, as communities, this is endangering our health, this is endangering our well-being, and how can we all work together? Well, for example, let's just think about the African American church for a second. It's a part of the community that can say, what could we do to help our children be healthier? How could we suddenly become models of healthy behavior for our children? How can we be part of the solution, not part of the problem?
Very good.
And a lot of things could be done within the church setting, within the school setting, and so forth. Okay, so all of those things on one side is trying to make this a healthier world, a place where it's easier to make healthy choices. You're not afraid of being mugged when you go out for a walk. You're not assaulted by, would you like that supersized every time you go buy some food? So it gets easier.
So this is the environment.
That's the environment side. Now, but in the meantime, if you take the path of least resistance, the consequences are pretty inevitable. So people have to begin watching their choices and begin sort of managing their own lifestyles, knowing full well that if I don't do something to make sure I stay healthy, I'm not going to stay healthy.
In other words, Dr. Schlunt, it really boils down to an individual responsibility. And those individuals who might, for example, those individuals who continue to smoke, who recognize that for the last many years we've had a campaign against smoking and et cetera, but they'll still contend that they can't quit smoking and they continue to smoke. Well, what do you say psychologically about an individual who either talks, well, any kind of addiction, you know, whether it's eating addiction or smoking?
Yeah, and addiction is a very difficult thing for anyone to deal with. And an addiction is motivated by the withdrawal. So if you're a smoker and you go for an hour or 2 hours without a cigarette, you'll suddenly be in withdrawal, and you'll be very uncomfortable, and the drug takes you back to the comfortable level. Well, that happens to some degree with some people with food.
So food, it can be an
addiction. Well, food for some people can be a tremendous source of comfort, yeah, and in fact, when you're working with your children, you have to help them learn that food is for nourishing your body, and there are other ways to find comfort from your parents, from your peers, through other means than to feed yourself to feel better. But again, I don't want it to seem like we're blaming the individual. Again, the solution requires taking some individual responsibility for yourself and for your family to make healthier choices, to make an effort to get out and walk, to make sure that your child turns off the TV and does something more active, gets away from the Game Boy and so forth. But it's not just that people are making bad choices, it's that all of these forces are pushing them to make those choices. So we're talking about, that's why it's so hard. It's as though you were trying to paddle a canoe up a stream. Well, the only way you're going to get to where you want to go is to paddle up that stream, but it's hard. It's paddling against the current. And that's the situation that we find ourselves in today, that our children are essentially paddling upstream, and they're going to have to learn to swim, or they're going to have to learn to paddle. They're going to have to learn to be somewhat deliberate about what they eat, and that there's something physically active that's a part of your life every day, and that's what it's going to take to stay healthy in a toxic environment, in an environment that's promoting just the opposite.
Well, do you think that it might be helpful if we were to really concentrate in terms of this whole obesity issue on the health aspect of it, to convince children and convince other folks that unless they take healthy action, that they're going to have to accept the consequences, diabetes, strokes, et cetera, et cetera. Is that what we're saying?
Yeah, and I think it can actually, you can approach it that way and say, unless you do something to be healthier, all of these terrible things are going to happen to you. The problem with being a 15-year-old and hearing that is that, but they're not going to happen for 40 years or 30 years. So the other approach is to say, if you feed yourself well and are active every day, you are going to feel better, you're going to have more energy, you're going to be able to do everything that you want to do. So if your friends say, hey, let's go run up that hill, you can run up the hill and you're not going to be out of breath. So there's a positive way to think about making healthy choices too. Some people will respond to the fear, others will respond to being drawn to wanting to feel better, wanting to feel like they've got control over their lives and so forth. But I think both perspectives are very important psychologically on your motivation to try to live healthy and to try to teach your children how to live healthy.
Very good. And of course, Dr. Schlunt, we've got about half a minute before the end of this show for today. But let me thank you for bringing that excellent information to us. And I think that more than anything, it sort of amplified the tremendous problem that we as a nation have in front of us if we are going to break this whole cycle of unhealthy children, childhood obesity, and I think that the differences that you gave us in terms of what's in the environment and individual responsibilities, I think that gives us something to work for in terms of trying to deal with this issue. And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and